the fact that they have a retained asymmetrical tonic neck reflex or symmetrical tonic neck reflex or a tonic labyrinth reflex, or they may not even necessarily seeing them appear right away developmentally. That there's that, like you said, there's that instantaneously developmental delay that's happening from the moment of birth that's now just literally holding up every succession of function.
There are these systems during physical movement and development. That movement is what initiates all brain growth. And movement initiates the engagement with the senses around us. So movement initiates the sensory exploration, and then that gets the sensory input, and that builds the brain, literally building the brain from the bottom up, right? So like a plant growing out of the ground with roots, or I use the analogy of like building a building. We have the foundation of the brain is in the lower part of the brainstem called the medulla oblongata. And the medulla is on line first when we're born. That's most active. The whole brain is active and growing, but what's most active and what's more developed at that point is the lowest part of the brainstem. And this is where most of the primitive reflexes come from. Also, you said the pons, which is the area of the brainstem above that, and that has some of it. But in those areas, there's other things happening, right? So in the medulla, the things to keep a baby alive right off the bat, like to be able to keep their heart beating.
Our autonomic centers.
Their autonomic centers, their vital centers,
vital
right?
centers,
That have vital, so that they have appropriate pulse rate and breathing and blood pressure, and they can do basic digestive functions. They can regulate hot and cold. And so the basic
And at that
functions,
moment, these infants are sympathetic dominant.
right. So when they're born, when we're born, our sympathetic nervous system, our fight or flight nervous system, is really more on high alert. And there's a nuclei in the medulla called the rostroventral lateral medullary medulla nuclei that is the one that is the primary nuclei for that sympathetic fight or flight system. And that's on high alert. And there are other nuclei that are there but are not really fully mature. And they will mature over the course of that first year and beyond as the brain grows. But if the brain isn't growing, then they may not mature. So we're born with a basic default system basically in our brain that's online. So a really simple basic operating system that makes sure that we stay alive.